Can you sleep too much? In this video, we are going to look at idiopathic hypersomnia. It can be incredibly frustrating if you feel sleepy and tired no matter how much sleep you have gotten. If you or someone you know struggles with this, go ahead and subscribe to my channel so you can keep on learning about sleep and mental health. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. This channel is all about holistic science-based strategies to optimize your sleep and mental health. Every video also contains a tip that you can use in clinical practice for healthcare practitioners. And doctors, before we jump into the video, I'd like to invite you to get my free sleep mini course called Sleep Medicine Pearls for Outpatient Doctors, and it's jam-packed with lots of clinical tips, pearls, and tools that you can use in your clinical practice to help your patients sleep better. The link to the course is shown on the screen here and under this video, and you can go to intrabalance.com/doctors to grab the free course. Today we are talking about hypersomnia. A hypersomnia is a condition associated with excessive daytime sleepiness. Other types of hypersomnias include narcolepsy and Klein-Levin syndrome. Thank you to my colleague Dr. Amelia, who requested this video on idiopathic hypersomnia. I do take requests, so if there are other topics that you want to hear about, especially if you're a healthcare practitioner, seeing patients in your outpatient practice who maybe have sleep issues or mental health issues that intersect, let me know in the comments or shoot me an email. I am open to taking requests and helping you get your questions answered. Okay, so if you feel sleepy during the day, no matter how much sleep you got, it could be a sign of an underlying condition. And one such condition to consider is called idiopathic hypersomnia. So this is a sleep disorder that is characterized by excessive daytime sleepiness. People might also have great difficulty waking up in the morning or waking up from a nap, to the point where it's like extremely difficult to wake up, and they might have symptoms of what we call sleep drunkenness. People with idiopathic hypersomnia, or IHS, might fall asleep at inopportune or inappropriate times during the day, and this can have a big impact on their day-to-day functioning. And one of the key points with IHS is that sleeping longer at night doesn't seem to alleviate the symptoms. Neither does taking naps. People just don't feel any refreshed after taking a nap when they have this condition. And one of the characteristics is regularly sleeping at least 9 hours, but sometimes even closer to 12 or 14 hours over a 24-hour period, and still never feeling refreshed. After waking up, people might have an uncontrollable desire to go back to sleep, and then they might have other symptoms like brain fog that affects their ability to concentrate and focus and get things done during the day, or they might even experience headaches or other physical symptoms. Now, there isn't a lot of data on looking at how common IHS actually is. It's thought to be pretty rare, but it is important to know about because it may be misdiagnosed as something else like depression. It can also be dangerous for people because of the excessive daytime sleepiness. They would be at a higher risk of car accidents and workplace injuries, and if you're a healthcare professional who has IHS, you're at a higher risk of making medical errors. So if this type of information is helpful for you, go ahead and let me know by clicking the like button. What causes IHS is also not really known. There are some cases of post-viral IHS. There's even some cases of it happening after COVID-19 infection, so there may be some sort of autoimmune component. There's one study that found that people who have high IHS have a higher rate of inflammatory conditions and allergies, or who have family members who have inflammatory conditions. There's a few small studies that indicate that it could be an excess of GABA, which is an inhibitory neurotransmitter in the central nervous system that can cause sleepiness. It may also be secondary to medical issues like a traumatic brain injury or dementia. And then it tends to typically affect males and females fairly equally, and then it often starts in adolescence or teenage years. So your typical story of someone with IHS is usually a teenager or a young adult who has long-term issues with just disabling excessive daytime sleepiness. They're sleepy all the time, they never feel refreshed, and then they may be falling asleep at inopportune times during classes, during exams, or other situations in which they just cannot stay awake. It tends to have a really big impact on their ability to function. And the symptoms usually come on kind of slowly, like over the course of weeks and months. It's not something that usually starts right away. So it might be a little bit insidious. Do you have IHS, or do you know anyone who has it, or do you see patients who have it, go ahead and let me know in the comments. So you might be thinking that this sounds a lot like narcolepsy, but there are some key differentiating features. One of the biggest differentiators is that for people with narcolepsy, daytime naps are a very strategic way to help alleviate the sleepiness, and daytime naps can be quite refreshing for people with narcolepsy. That is not the case for people with IHS. They feel sleepy no matter how much they've slept and even if they've taken naps. And remember, the overnight sleep duration is usually somewhere between 12 to 14 hours over a 24-hour period, and yet they still feel sleepy. People with IHS can also have sleep paralysis and hypnagogic hallucinations. This can happen in narcolepsy as well. So sleep paralysis is a complete inability to move when you're kind of transitioning from sleep to wake. And then hypnagogic hallucinations can be pretty disturbing, and they can be visual or they can be auditory, they can even be tactile hallucinations that happen as you're transitioning from wake to sleep. And they can kind of be a little bit nebulous, dreamlike experiences, but they can also feel very vivid and very real, and hence very scary sometimes. And as far as testing, so if you're seeing patients and you want to know what tests should I do, what rating scales should I do to kind of further evaluate this, of course you're going to start with a really good history and look at some of those differentiating features from other conditions. But you can also do an Epworth sleepiness scale, and an Epworth more than 10 is indicative of excessive daytime sleepiness. There's also a 14-item Idiopathic Hypersomnia severity scale, the IHSS, which you can administer in clinic. You can have your patients do a sleep diary. You can use the AASM sleep diary. It's free PDF that you can download, and you can track their sleep over the course of a couple of weeks and see how much sleep they're getting over the course of a 24-hour period. And you can also use actigraphy as well, which is a device that the patient can wear at home to track their sleep patterns. Now, IHS is a diagnosis of exclusion, which means that you need to do a really thorough history and workup to rule out other conditions that could be contributing, like other sleep disorders, like sleep apnea or depression, or if it could be substance related or related to sedating medications that they may be taking, and so forth. A really simple thing is you want to make sure the person is getting enough sleep, because a lot of people will complain of excessive daytime sleepiness, and then you take a history and it turns out they're just not getting enough sleep on a regular basis. And so sleep deprivation can look like IHS sometimes. And then of course with adolescents and young adults, you want to make sure that it's not a circadian rhythm disorder like delayed sleep phase syndrome, which is pretty common, relatively speaking, in young adults and adolescents. I mentioned that you want to rule out sleep apnea, so you can do an overnight polysomnogram. And with excessive daytime sleepiness, you can follow this with an MSLT. So in the overnight sleep study or polysomnogram, you want to make sure they got adequate sleep and that they didn't have sleep apnea. And then the next day, you can do an MSLT or multiple sleep latency test, where the patient stays in the sleep lab and they're given 5 opportunities to take a nap, and you're essentially seeing how long it takes them to fall asleep, if they fall asleep, and if they go into REM sleep during the naps. With IHS, usually the average sleep latency is less than 8 minutes over the course of those 5 naps, and then you'll see they have less than 2 SOREMs, or sleep onset REM periods. Whereas with narcolepsy, you'll see 2 or more sleep onset REM periods typically. Now, the thing is with these sleep studies and the daytime nap studies is they're not totally diagnostic in and of themselves. You do need to take a good history, take into account the whole picture, and you want to make sure the sleep studies were done optimally, because there can be a lot of variability in the quality of these studies, especially with the daytime nap studies. So let's say you have a diagnosis of IHS, or your patient now has a diagnosis of IHS. What are you supposed to do? So this year in 2021, after more than a decade, the AASM, the American Academy of Sleep Medicine, released new treatment guidelines for the treatment of IHS. Now, we're still at a stage where most treatments are focused on symptom suppression, so really trying to suppress that daytime sleepiness. Therefore, a lot of the treatments are still stimulant medications, so like amphetamines, like Adderall, or methylphenidate, like Ritalin, or wake-enhancing medications like modafinil or Provigil. And then this year, actually in 2021, the FDA approved the use of Xywav, which is also used for narcolepsy. So it's now also approved for the use of for the treatment of IHS in adults. There are a couple of other interesting sort of avenues that are under exploration as far as pharmacological or drug treatments are concerned. So one of these is clarithromycin, which is an antibiotic actually, but it's shown to modulate GABA activity. So remember earlier, GABA is that inhibitory neurotransmitter. There's a theory that maybe people with IHS have too much GABA in their central nervous system. The other drug that's under investigation is flumazenil, which also modulates GABA activity. So these two are still being tested and under investigation. So we'll be interesting to kind of like see what comes out of those research pipelines. So here's your tip for healthcare practitioners. If your patient is taking any of these types of drugs, so these stimulants or wake-enhancing drugs, you want to be really careful about other comorbidities that they might have, because some of these drugs can exacerbate things like anxiety or high blood pressure, or if your patient has coronary artery disease or other cardiac conditions. You just want to be really careful with using these drugs. So keep an eye out for that. You also want to keep an eye out for drug interactions. So these wake-enhancing drugs like modafinil or armodafinil can potentially affect the efficacy of birth control pills. So if you have patients taking those, watch out for drug interactions and make sure you have those conversations with your patients. There's also a potential risk with blood-thinning drugs like Plavix. So if you have patients taking that, bear these interactions in mind. And if you are a patient taking these kinds of medications, make sure you update your doctor about all the drugs you're taking. Because sometimes patients will tell me like, oh, I was prescribed something, and but you probably don't need to know that, do you? And yes, we do. Because of these drug interactions, it's really important that your doctor has all the up-to-date information. So can you treat IHS without medication? There is some investigation going on into circadian rhythm variants of IHS. So there may be some utility in circadian rhythm treatments or behavioral modifications there. There are some case studies on using the ketogenic diet in patients with IHS. This is in its very early stages of research, so a lot more research is needed to understand the use of specific diets, medical diets like the ketogenic diet in conditions like this. But some general recommendations for anybody, whether you have IHS or not, you want to make sure that you're optimizing all the other lifestyle aspects like your diet, and that you're eating a well-balanced diet full of fruits and vegetables, that's high in fiber, that's low in processed foods, that is going to give your body good nutrition and good fuel so it can function better. Make sure you're getting exercise and moving your body on a regular basis. If you don't use it, you lose it. Make sure your vitamins and micronutrients are optimized so you can get some of your vitamin levels checked, like your vitamin D. You can make sure your B vitamins are optimized, that you have good, sufficient levels of iron and ferritin and magnesium. So do have a conversation with your physician to see if it's appropriate for you to get any of those things checked, or if there are other vitamins and supplements that you should consider taking. And of course, as far as sleep is concerned, you want to make sure you're keeping a regular sleep routine, that you have good sleep hygiene, that you're avoiding alcohol and sedatives before bedtime. For people with IHS, or even more general excessive daytime sleepiness, you want to avoid long drives. Behavioral modifications like scheduled naps, as I mentioned before, may not be as helpful for people with IHS as they can be in narcolepsy. And don't forget other aspects of health like social connection. Hypersomnia conditions can feel quite isolating because, one, they're not really well understood. And if you're experiencing this condition, your family and friends and partner may not quite understand what you're going through, and that can feel pretty isolating. So if you're struggling with this, or you see patients who have this, it may be a good idea to connect with a therapist who can help with some of the other emotional challenges that come with these conditions. You may also consider connecting with a support group, and there are support groups out there for hypersomnia. If you found this video helpful, go ahead and let me know by clicking the like button. And if you have any questions, drop me a question or a note in the comments below.